Eli Lilly's blockbuster weight loss drug, which is also an anti-diabetes drug, is set to launch in India this year. And to talk about that, I have with me Rachel Betterham, Senior Vice President, International Medical Affairs, Eli Lilly. Thank you so much, Rachel, for joining us. I have so many questions that I want to ask you, and let's start straight from asking you what are your plans on launching Mounjaro in India? When and most importantly, at what price?
So firstly, thank you so much for having me here or allowing me to be here today. Lilly is really committed to improving the health of people in India living with type 2 diabetes and living with obesity. And we aim to launch Tirzepatide in India in 2025 after we have obviously all the necessary approvals to be able to do this.
At what stage of regulatory approvals you are on?
We're almost there, so we're quite hopeful that it will definitely be in, well, it should be in 2025, and that's what we're aiming for.
If I want to get more closer and more clearer to the answer, can I say the uh, maybe post August or half the?
I wouldn't like to speculate. So let's just say we're aiming for 2025.
Okay, and then the most important questions, which I'm sure that many Indians would also want to know, that what will be the pricing strategy of Eli Lilly to launch this drug in India? Because affordability is one of the most crucial aspect of launching this drug.
Yeah. So we haven't yet finalized the pricing strategy for Tirzepatide. Our pricing will reflect the medicine's efficacy and the fact that it really improves overall health and reduces the economic burden of type 2 diabetes and also obesity. But we haven't yet finalized the pricing.
Right. So when you talk about the efficacy of the drug and all those aspects, can you talk little more about the working mechanism of this drug?
Yeah, of course. So um, Tirzepatide targets two naturally occurring regulatory systems in the brain. So it targets two gut hormones, GIP and GLP-1 receptors. So it's one molecule that targets these two systems that we know from lots of scientific research regulate appetite, food intake, and also regulate blood sugar. So it's working on the body's own natural regulating systems to help reduce appetite and food intake. And for people with type 2 diabetes, then it lowers blood sugar. And
Right.
it's obviously it's a prescription only medication and it's a once weekly injection.
So what do you suggest to people who generally presume these kind of drugs as cosmetic products? Because this is one of the most critical and crucial issue that we need to talk more about. We have seen the other drug, Ozempic, which has gained a lot of attention for its anti-obesity or weight loss drug properties. How do you want to position Mounjaro in the market so that people don't start misusing it?
So I think the real important thing is that people understand that obesity is a serious chronic disease. We know that obesity leads to lots of other health complications and it also reduces life expectancy. So we really need to reframe obesity. This is not a cosmetic thing. This is a disease that leads to early death. And I think that's the really important thing. And at the moment, people with obesity don't receive the same sort of treatment as other chronic diseases. So obesity is often not diagnosed, or if it is diagnosed, people don't have access to comprehensive care. So people need advice on lifestyle, diet and exercise. Those who need medication should have access, and also people who need bariatric surgery. So it's a whole pathway that's needed. But we also need to think about prevention. So we need prevention and treatment. So it's the whole system that needs to be looked at and to really get away that this is something that's just for cosmetic and really focus on health. I think we really want to focus on improving health for both people with obesity and type 2 diabetes.
I'm sure you must have tested waters in India before you plan to launch Mounjaro. What is the status of obesity in India? What are your findings about the Indian market when we talk about obesity?
So if we look globally, there's more than 1 billion people currently living with obesity. And that's every single area of the globe. So we define obesity based on body mass index. So the WHO globally defines a body mass index of over 30 as a person having obesity. But it matters where your excess fat is, okay? And the people who put excess fat around their tummy are at greater risk. And for Asian people, when they start to put on fat, they tend to put it around their tummy. So for every BMI, at a BMI of 30, that's too high as a cutoff for people in India, because the risks of obesity start at a lower BMI. So in India, the consensus is a BMI of 25 or more is classified as having obesity. And also the waist circumference is really important. So the prevalence of obesity in India, whilst lower than other countries, is increasing. So we also know from an economic survey that was done in 2024 that people in India are worried about obesity. But so in terms of the number of people and the fact that it's a serious health condition, then that's why we're really committed to really bringing Tirzepatide to India to improve health.
What does the data show? You have done multiple clinical trials to understand the efficacy of Mounjaro. So, what does the data tell us? How safe this drug is? How efficacious this drug is?
So again, the drug should always be given together with lifestyle advice. So the healthcare provider looks at the risks and benefits for the particular person they're seeing and then decides on treatment. Tirzepatide has already been given to millions of people globally, where it's been shown to have a marked impact on improving health and obesity-related complications. Lilly takes safety really seriously. And in all our clinical trials, and then subsequently, we're looking at safety. And there are some people who shouldn't have Tirzepatide. So, for example, people with some rare conditions such as MEN type 2 or medullary thyroid carcinoma, pregnant women, women who are trying to get pregnant. But in the vast majority of people, Tirzepatide is safe.
Okay. Do we really need drugs to lose weight? This is one of the question when
Yes.
people don't understand that it's okay.
Yes.
We are
Yeah.
plump or we are fat, or but do we really need drugs to
Yeah.
lose weight? Can't we do it just with food or lifestyle?
So previously, everybody's focused on lifestyle interventions, and obesity has been viewed as a lifestyle disease. But over the last 30 years, we've done a huge amount of research. Not just Lilly, but the whole scientific community has done a huge amount of research and realized that it's actually really difficult once you've gained weight to lose it. And this is because if you think about evolution, during evolution, we had a situation where food was scarce. And if food was available, we are hardwired to eat it because then that would allow us to survive if there was a famine. And when a person starts to lose weight, their body does everything possible to get them to put the weight back on. So once you've developed obesity, you start to go on a diet, you lose weight, your body responds to that by changing all the hormones and driving an increase in hunger, which then often leads to people to put the weight back on. So weight loss is possible. And lots of people can lose lots of weight. The problem is maintaining the weight loss because the body drives you to put the weight back on to go to the highest weight that you've ever been. And we understand the biology of that now, but there's so much stigma for people living with obesity because of the view that, well, you just need a little bit more willpower, that you could exercise more, eat less, and then you'd lose weight. But as a medical doctor, we know that obesity causes ill health and for people to die earlier. So it's like any other disease. I would treat a patient with high blood pressure, I'd treat a patient with asthma, and we now have evidence-based treatments that we know improve health. So why wouldn't we use them in those people who need them?
Right. Rachel, just in simple language, just in, five, six sentences, can you explain our viewers why obesity is not good for them? Because sometimes, or I would say majority of the times, we don't consider obesity as a disease.
Yeah. So excess body fat releases many substances which then have a bad effect on the rest of your body. And in particular, causing type 2 diabetes, heart disease, strokes, linked to certain types of cancer. And then there's the impact on your joints. So arthritis, problems with stopping breathing when you're asleep, problems with leaking urine, and many other problems. There's over 200 complications that have been linked to obesity. And more importantly, we know that if people can reduce the amount of this excess body fat, then that improves their health. So that's why we really need to change the view. Obesity is a disease. It's not just being bigger or cosmetic. It's a disease that seriously affects people's health and leads to people to die early.
Right. So obesity is not as simple as we presume it to
Yes.
be. It's
Yes.
not just the shape of your body, but it comes with a host of other health problems,
Absolutely.
including cancer, arthritis, lot of heart diseases,
Infertility as well.
infertility as well. Right. So, Rachel, how important Indian market is for Eli Lilly, specifically when we see the launch of Mounjaro coming, considering that India is also world capital of diabetes.
So Lilly has been in India for nearly 30 years. And we have a long history of really trying to help people holistically with type 2 diabetes. And we now want to bring Tirzepatide to help people with type 2 diabetes and obesity. So it really is a key market for us to try and improve health. So, but the focus here is not just on bringing medicine, but it's on changing how people view obesity and also a whole comprehensive care package. It's not just the medicine. You have to think about everything else as well. So India is really important to us, but from a health perspective, to actually improve the health of patients in living in India.
Right. Again, I'm coming back to the few questions that I asked you earlier, hoping for some replies this time, maybe. So, by when we can, Indian consumers can or Indian patients can expect the drug to be available in India? The
We are
first half,
aiming,
second
we're
half.
aiming for 2025.
Okay. Okay. Great. Thank you, Rachel, for
Thank you.
joining us. It
Thank
was a
you for
great
having me.
information. Thank you so much.